Acrokeratosis paraneoplastica. Acrokeratosis paraneoplastica is a rare acral psoriasiform dermatitis associated with internal malignancy, most frequently squamous cell carcinoma of the upper arteriosus tract, also known as Bassett's syndrome. Applications in medicine. 72-year-old patient with a personal history of squamous cell carcinoma of the soft palate who had undergone surgery 4 years previously with cervical lymphadenectomy arrived to external consultation service for the appearance 2 months before of asymptomatic skin lesions of progressive growth in the auricular pavilions, the palms, and the toes, which had not received any treatment. The physical examination showed keratotic yellowish-brown fissure plates distributed bilaterally and symmetrically in both heads, palms, and toes. An endoscopy was performed with visualization of infiltrating lesion in the middle third of the esophagus that affect 25% of the circumference. In the same act, a sample was taken of biopsy with the result of poorly differentiated cells.
There is no cure for psoriasis, but it can often be managed with medications. Those with psoriasis in the ears may require close medical care to keep flares under control and to avoid problems such as hearing loss. Some psoriasis medications should not be used inside the ears. The delicate eardrum may be harmed by some topical creams and ointments. For this reason, patients should ask their doctor about medicines that are safe for the ear canal. Options may include liquid forms of steroids that can be dropped into the ear. Liquid steroids mixed with another psoriasis medication, such as a vitamin D cream. Antifungal dandruff shampoos used while bathing to help clean the ear and kill fungus. Pills that help decrease the immune system reaction that causes psoriasis. This type of therapy may help if a patient has psoriasis in the ears or other sensitive areas and drops or creams are not effective. Warm olive oil dropped into the ear. The oil can help keep wax moist and lubricated, enabling it to move out of the ears. This can help keep the ears clean by preventing the wax from building up on top of psoriasis scales. If ear psoriasis interferes with hearing or causes discomfort, a doctor can remove the scales and wax safely and effectively. Individuals should not stick objects in their ears or try to remove the scales themselves. Accidentally pushing the debris further into the ear can make the problem worse by causing a blockage, damaging the eardrum, or injuring the skin. Psoriasis triggers and flares. Psoriasis triggers can vary from person to person. Some people find that certain triggers make their psoriasis temporarily worse before it returns to normal again. Others experience a permanent worsening of scales and symptoms. Either way, most people with psoriasis should try to avoid triggers whenever possible. Those with psoriasis in the ears may find that a flare can suddenly affect hearing, and this can be particularly bothersome and stressful. Common triggers of psoriasis include stress, although stress cannot always be.
Pros. This pathology is easy to diagnose because of the unique signs and symptoms: erythematous, tuberculous, psoriasiform plaques predominantly located in acral areas, nail dystrophy, palmoplantar keratoderma, and alopecia. Cons. In most patients, the cutaneous manifestations of Bassett's syndrome precede the diagnosis of malignancy, most often squamous cell carcinoma.
Squamous cell carcinoma is the second most common type of skin cancer, affecting 250,000 Americans annually. So what is squamous cell carcinoma?
Squamous cell carcinoma, or SCC, is a type of cancer that forms on the skin's outermost layer. If left untreated and allowed to spread, SCC can cause severe scarring or, in up to 4% of cases, death. The best way to avoid these consequences is to avoid the sun. Like 90% of skin cancers, SCC almost always arises from overexposure to the sun's harmful ultraviolet rays. Chronic sun exposure isn't the only factor that can make you a more likely candidate to develop SCC. However, knowing if you're a high-risk candidate can help you to protect yourself. Unlike the other types of non-melanoma skin cancer, SCC can arise from chronically scarred or inflamed skin. The human papillomavirus, which often causes warts, can also lead to SCC. People with weakened immune systems or immunosuppression have a higher risk of developing SCC. Possible causes of a weak immune system include the HIV virus and organ transplant medication.
Issue applied in Ecuador. This disease is a very rare paraneoplastic phenomenon. There has been described only 145 cases in which 16 of them were female. There are no reported cases in the Ecuador. Conclusion. Although basic syndrome, Acrokeratosis Paraneoplastica, is a very rare disease, it's very important to take in consideration because with an early diagnosis, you can prevent the evolution of the malignancy that precedes this disease.